do you do two-stage or one-stage correction when they have a hindfoot deformity associated with the ankle arthritis? And the question is, what should you do? For the patient, it seems theoretically better to do it in one stage, to get it out of the way. It's done. We were talking about this at dinner. Sometimes doing a one stage is a lot of free surgery from our part. We're not getting paid for a lot of it. Not that's the reason not to do it, but there's also risks. I'm going to go through some of the data that's out there. In general, you cannot predict what happens to the foundation. So if you do all of it at once, you do an ankle and the hindfoot. For all of us that do a lot of hindfoot, you know that whatever it looks like at time zero in the day of surgery, when you follow them out for a year, or even 6 months, that foot shape isn't the same. So you can do all this work at once, but you're not really sure what the foundation is going to be. So you may undercorrect, overcorrect. It may not be the best thing for the ankle after 6 months or a year. And so things settle. So it may not be from a mechanical standpoint the best idea, even if you can physically do it. Replacement's a reasonable option. We know that. So when you have such severe deformity, the ankle sideways and the hindfoot sideways, you can do a replacement. These are some just meta-analysis and things like that that we looked at. And we all know that ankle replacement's a safe option, even in the setting of a deformity, as Michael already showed. One of the things for hindfoot fusion, which is the most common associated procedure we do with the total ankle, is the question is, does it matter if you do it at the same time or not? The Duke group looked at this, and they looked at staged versus simultaneous total ankle and hindfoot fusion. They actually have one of their studies showed it doesn't matter if you do it or not. The rate of subsidence is the same. However, when they looked at their data carefully, the dorsal plantar screw through the sinus tarsi, those patients actually had increased subsidence. So the recommendation was, yes, you can do it, but you can only put your screws from bottom to top so you don't violate the sinus tarsi, which is great on paper, but a lot of us anybody that does this, there's not a lot of room to put plantar dorsal screws in because the implant's literally in the way.